Good evening, everyone, and welcome to our webinar. We'll start in just a couple of minutes, just as people are coming in the Zoom room. So settle in, and we appreciate your being here with us this evening. And we'll get started in just a minute or two. All right, well, welcome. My name is Julie Baker, and I want to welcome you this evening to our webinar here this evening. We were just waiting for a couple more folks to come in the room, but my name is Julie Baker. I'm the Executive Director of Californians for the Arts. My pronouns are she, her, hers, and I'm joining you this evening from the unceded territory of the Nevada City Rancheria Nisenan, also known as Nevada City, California. Californians for the Arts is pleased to continue our work on reopening arts safely with a three-part series in collaboration with USC Keck School of Medicine Center for Emerging Pathogens, entitled Living with the Pandemic, Safety Guidance for the Arts. The goal of this series is to help those who work in the arts, culture, and creative industries be prepared to reopen programs and venues safely with the most up-to-date and scientific-based information. Tonight, we will discuss clinical perspectives on the pandemic, past, present, and future, and the importance of collaboration between state and local health departments to serve artistic communities. Discussions will intersect perspectives on policy and governance, vaccination requirements, and pop-up initiatives. We will also exchange views on how toolkits and guidelines have changed over time and where are we now. We will inform how the continued response and recovery will unfold as the Department of Public Health addresses the Delta variant and discuss the importance of various mitigation measures and recent guidance and recommendations for the events and arts industries. The format we will use tonight is a conversation between experts with opportunity for Q&A from you, the audience. Please use the Q&A function in the bottom right of your screen anytime for questions. Please also introduce yourself in the chat and share the land in which you're zooming in from too. Tonight's presentation will be recorded and available for viewing in a day or two. Please also sign up to join us on November 17th, where we'll focus on youth programs, and December 15th in a conversation on sharing best practices for reopening programs and venues from experts in the field. All of our programs are free, but we do ask you consider joining our organizations. So now let me welcome our esteemed guest this evening. On our guest panelist today is Trudy Raymundo, Head of External Affairs, COVID-19 for the California Department of Public Health. Trudy, it's great to see you and welcome.
Hi, Julie.
And then I'd like to welcome our partner on this series, Dr. Nanda, Founding Director of the Center of Emerging Pathogens of the Keck School of Medicine of USC and an infectious disease physician. Welcome, Dr. Nanda.
Julie.
How are you tonight?
Great.
I know you've had a long day already in the hospital, and so thank you so much for joining us here this evening. And please, why don't you tell us a little bit about what we're doing, Californians for the Arts, and you.
Thank you, Julie. Welcome everyone again. As Julie and I and Tracy and Trudy, we've been chatting over the last few weeks. One thing is very obvious. The silver lining through this pandemic has been really the cross-pollination between different disciplines. And I think this webinar with our series is a perfect example of that. And I hope you'll be enjoying our insights and conversations. These are really questions that each one of us had in our own worlds. And it's just been wonderful to talk to our partners, and we'd love to share our conversations with you.
That's terrific. And did you want to introduce your partner in crime, Mel?
Yes. Mel, our program administrator for the Center for Emerging Pathogens at Keck School of Medicine at USC. She will be helping us in moderating our conversations today. So Mel, it's all yours.
Hi everyone. Thank you so much. This is just a quick disclaimer that the information shared during this webinar is intended to provide general education, observations, and public health strategies, and any portion thereof are not to be construed as medical or clinical advice. Okay, now that that's out of the way, just a reminder, if anyone wants to submit questions for the Q&A portion, again, please do so in the Q&A chat. With that, Dr. Nanda, why don't you start us off with the medical perspective of all things pandemic past?
Yeah, so about the past, we call it the past, but it was just last year, Jan 2020, if you recall, when in the United States, our first case of COVID was in Washington State, a person who had traveled back from Wuhan, China, and it was Washington State. He wasn't feeling well, fevers, chills, shortness of breath. And since then, I think all of us here, and I'm sure the audience can also relate to it, it's been an incredible journey. We have learned things, if not every day, by the hour. I remember earlier on in January when it started, before it was even declared as a pandemic, we already had whisperings of something's happening. The way information was flowing in was incredible. And what have we learned? I'll tell you, from a clinical standpoint, it is amazing. This virus, the implicating virus, SARS-CoV-2 in COVID-19, can impact almost every part of our body. And what's so perplexing is that even after you recover from your illness, acute illness, there is this syndrome that we've discovered. It's post-COVID, long COVID syndrome, which, depending on the studies you look at, could vary from 15% of the people to 30% of the people. And it varies with age too. So that's what we keep learning. And now, in fact, NIH has invested so much in trying to learn more about post-COVID, because that's an area, it's not just a phenomenon, but it's something that we need to understand more, because there are going to be so many people who will be suffering from it, which we are seeing currently in clinics. So the clinical piece is something that has evolved as time has gone by. What else? If you think about, it was in Jan last year, and by December, we have a vaccine. We're going to get into how you get the vaccines into the arms, right? So vaccine to vaccination, but so much of advancement around treatment and therapeutics. It's amazing, right? When you talk about the past, we had so many deaths. Our hospitals were flooded. This was all in the absence of vaccines. Today, that's not the case. Places where vaccines are good, masking is good, that's not the case. Sorry, I pivot. I should stick to the past. But as you can tell, it's all so connected and it moves so quickly. And I'll tell you, in the past, how did we learn that piece around? I remember, that a person who is infected with COVID can so effectively transmit the disease 2 to 3 days even prior to having any illness, any symptoms. And that is what has been a challenge in trying to contain it. And when you talk about transmission, you talk about masking. If you recall, there was such a divide, even in the healthcare facility. We were not convinced that we are supposed to wear masks all the time. But this is how the past is now our present, where we are wearing masks everywhere. Mel, I could keep going on and on about the past, but I'll pass it on to you to ask any questions or anything else you'd like me to comment on.
Yeah, if you'd like to comment on the lessons we've learned through the first round of reopenings, especially in the arts community.
Yeah, that's an interesting question. It was in summer when our rates were so low. There were such few cases, but let's not let history repeat itself. So it's nice to revisit how we could have done it better. And I think, had we done it in a little more, perhaps not as swift, with more caution and more staggered and slow, we would have continued normal operations perhaps for longer. And, the winter surge, maybe we would have delayed it. But I think with the excitement, all of us ramped up, many of us, and we opened up quickly. So perhaps next time around, I hope there isn't a next time around, but like I was taught, you can't outsmart bugs. You just can't. They multiply at a pace that we don't. All the same, we have vaccines, but I think next time around, we want to be slightly more cautioned and staggered as we hope we never close. But should it come to that, the reopening should be staggered.
Julie, I know the arts community has faced a lot of hiccups in the face of
One way of putting it.
Yeah. What was the sentiment during summer and winter last year within the community?
Well, for the arts community, as the saying goes, we were the first to shut down and the last to reopen. And when, March came, we had to really just, everything shut down in the middle of people's seasons. All of a sudden it's just close up, which is, you can imagine, devastating both for emotional reasons in terms of if this is your livelihood, as well as, of course, economic reasons. And then what happened was, as the state started to address how to keep people safe, and to sort of this balance of commerce, keeping business going, and safety, they started to do these blueprints, right? And coming out with ways and guidelines and guidance for certain industries to reopen. And the arts were not a part of that. We weren't actually even on the blueprint. Even in the best tiers, we weren't there. And so the signal to us was that basically, when the pandemic's over, you can reopen, which of course, in March, everyone thought it was going to be over in June. So I think we were sort of like, okay, we all went home and sat down and waited for it. But then when it kept going, and we realized that it wasn't going to be that fast, I think, reached out to, the governor's office and CDPH in June of 2020 and started saying, how about us? What's going to happen for us? And because gathering was the main thing that people said was absolutely a no-no, and gathering is what we do for a living, we essentially were told, you're not, we don't see you right now, just go dormant. Which, as you can imagine, again, for an industry that was somewhat financially fragile to begin with, that was devastating. And so it was also devastating emotionally in terms of not understanding where you are as a part of the potential reopening, as well as the fact that the arts can bring so much healing and hope and mental health benefits to people. We were sort of sitting there going, we need this, you need this. So really, it came down to us eventually getting to a place where we were able to get some meetings with CDPH, with Trudy and her team, and GoBiz, the Governor's Office of Business and Economic Recovery and in business. And they really started working with us and collaborating with us and listening to our sector and understanding what our needs were, because it's not, as I'm sure Trudy will say, they're not experts at our business. Oh, yeah. We're the experts at that. And what we wanted to do was to provide that information back to them so that when they were going to get to a place where they were going to reopen, that it was done in a way that we could actually make it happen. And, we wrote op-eds, for example, talking about the fact that, bars were open, but performing arts centers were closed. Bowling alleys were open, but performing arts centers were closed. And we were sort of like trying to understand the logic behind that. And I'm not sure anybody understood the logic behind that in the beginning. In fairness, I believe the state was doing the best that they could to try and address something that no one really saw coming, I would suppose. So, it took some time. It took us actually it was April of 2021. Is that this year? This year? Gosh, crazy. April of this year that we finally got guidelines. And I say finally, sorry, but that was because it felt like a long time to not know what we could do. And then when we got those guidelines, it was very, as you could imagine, capacity restricted, right? So it was like, yes, you can open, but 25% here. It was very detailed. It was challenging. We did webinars with Trudy and others to try and explain this to the field. But economically, it was very challenging for our sector because it's hard to be able to make it pencil, as you say, when you've got 25% capacity or 50%. And so there was a lot of people saying, we probably won't even reopen. We'll just keep doing what we're doing, which is doing our best to bring online delivery of shows and things like that. And then June 15th came, which is when the governor announced that we were doing so well, we could go beyond the blueprint. And Trudy will speak to much better detail to this than I can. And it really lifted all capacity restrictions. It really started to say that we were going to go back to the way things used to be in some ways. And then the Delta variant came and things started to change again. So I think, I don't want to speak too much because I think most of the people on this call are people who are experiencing it. My job is to do our best as Californians for the Arts and California Arts Advocates to represent that to the policymakers, to make sure that they understand what needs to happen in order to address being able to get this really vital sector back to work. And I'm really happy that we got a chance to meet Trudy and her team and really work collaboratively with them. And I think the work continues because obviously, as this title is called of the series, it's living with the pandemic. We're not post-pandemic. I think, as Dr. Nanda once said, we're post-vaccine. And so what does that look like? So that's kind of the past of how we got to where, we got to really hopefully start to see some significant change in the ability to reopen our sector.
Yeah, it's obvious that Californians for the Arts has done a lot of advocacy work for the arts industry throughout the pandemic. And from that, a lot of collaborative efforts were born, especially with local, state health departments. Trudy, do you want to speak to some of the past collaborations with the arts industry that CDPH has been a part of?
Oh, absolutely. And to set a little bit of context, just so folks know, I've worked this pandemic, actually the first part from January through the end of May of 2020. It's hard to imagine I'm saying 2020 at the local level, and then came to work at the state. And so have been working this pandemic at the state level since that time. And I think folks, forget the very early part of the pandemic with our stay-at-home orders, where, and if you actually look, we've actually did a timeline at some point on the various stay-at-home orders and then the regional stay-at-home orders, if people remember those, and how we've kind of integrated some of the economic openings within all of those things. But once we were really getting past some of the stay-at-home orders, and that was really kind of our first reaction on how to really protect the community and really protect our residents and protect, everybody in the state. As we started to move into the summer of 2020, we started to think about that idea of reopening. How do we start to move into being able to allow certain sectors to reopen? Because we knew, I think everybody acknowledged just the financial and economic impact and just the mental health impact. Being, in a stay-at-home order for that many months can be really, really difficult. And you could see that folks were to at least the thought of trying to at least kind of get back out into the community. And so who can ever forget the blueprint? As Julie had alluded to, those 4 wonderful colors that I will never forget, the purple, red, orange, and yellow, where we had classified the various counties depending on their case rate, their test positivity, and then a little bit later on, we had included a health equity metric. And that was really kind of our baseline for how we were starting to think about kind of, where we would then intersect industry into a lot of that effort. And then we looked at the various sectors. And there was really a variety of things. And I think, Julie, to your comment, I think the one thing we weren't mindful of is verbalizing or messaging, how we were looking at the various sectors. We probably absolutely could have done a much better job in terms of kind of messaging, the criteria we were looking at, which was, can you maintain a mask the entire time while you happen to be in that setting? Was there the ability to do physical distancing, capacity limitations? We were really focused on too is how long people from different households would be in a particular setting. Obviously, it also looked at outdoor and indoor, which we still very much focus on now, just because, early on we knew an outdoor setting was always going to be safer than an indoor setting. Because of, of the way that we had seen the disease, in terms of particles and things like that. And indoor settings just don't normally, allow itself for natural airflow and ventilation. We looked at kind of, how different households would be coming together for the particular setting. And that's really kind of how we started to think about how we approach the various sectors and how we started to include various sectors within that blueprint framework, whether they were going to open, while they were in purple with certain capacity limits, or we were going to ask them to wait all the way up until somebody happened to be in yellow for certain capacity limits. But also, trying to be mindful, as we're approaching various industries. And as Julie said, unfortunately, the arts industry was the first to close and the last to reopen. Because I think, again, we were really just trying to think about some of that criteria that we were looking at that we considered kind of, what are the riskiest? What are some of the riskiest settings? What are some of the places that had the potential for some of the riskiest activities? And with that, we had a pretty good toolbox, and as Julie can attest, the guidance that we eventually put out, it was thick, it was long. We had quite a few things in there, and why it was so important when we got to that place of being able to put out guidance for live events and performance to work with folks like Julie in the sector, because we had a big toolbox. And we try to use everything in the toolbox in that guidance. If you think about it, we had requirements around masking. We had requirements about physical distancing. We had requirements about capacity limits. We had requirements about travel and who could attend the event. If you were from out of the region or out of the state, we had requirements about food, whether you could or couldn't serve food, whether you could or couldn't serve drinks. We had, in some instances, time limitations. If you think about some of the settings, we said, nope, you can only serve from this time to this time, and then you had to close at a certain time. And so, even later on in the pandemic, one of the nice things, though, that we did have with some of the industries that opened later, we had vaccines at least available to us, so we could start to integrate vaccines and testing into some of that industry and as well, and hopefully allow for a little more flexibility for the industries if we could really encourage folks to get vaccinated. And we really try to be mindful about, what latitude we could provide if an audience was fully vaccinated or fully tested or a mix of those things. But as Julie said, even as we develop this guidance, from a public health standpoint, we don't know how to run business. That's not our business, is to tell business how to do their business. And so it was really important, to be able to connect with Julie and her folks, because we could write all the guidance we wanted and put in all of the requirements. We even have requirements on how performers were supposed to perform, about wind instruments, all of those things. But if you couldn't operationalize it, the whole effort was for naught. And that was really a big focus for us as part of that collaborative effort, was making sure that what we put on paper could actually be operationalized, that you could actually put it into place. And then the other big question I think Julie always asked was, is this even economically feasible for you? If we were to start to allow the sector to open, are the capacity limits we put into play even economically feasible. Is it economically feasible for you to have an event at 15% capacity, or do we need to think about strategies so that you could get up to 50% capacity or 75% capacity? That was always a big question for the sector, was making sure that, not only was it operational, but that it could be economically feasible. I think the other idea too, early on as we were working through industry, especially for some of the ones moving later on, is we knew, and I'll talk about it a little more in terms of kind of what we're looking at in terms of the present. We introduced some things in there around like vaccine verification and testing, because we talked about it as, let's see in this short term if that's operational as well. How do you put some of those things into place and be able to continue to protect your consumers, your audience, as well as your workers? So it also gave us a little bit of a bridge as we started to knowing that we were going to get beyond the blueprint and start to open up the economy to the greatest extent. It gave us a little bridge to test out a couple of things that we were thinking about for the future, being able to continue into the future, which now is our present.
Yeah, clearly the availability of vaccines was that bridge that carried us from the pandemic past to the pandemic present. Dr. Nanda, do you want to speak a little bit about how that availability progressed through recent months and how that has led us into where we are, where we currently stand?
Yeah, it was so interesting to hear Trudy go through all the measures. And in my head, what I'm thinking is about that pyramid. And really right on top, with different controls, with different mitigation strategies. And the one on top is vaccination, without a doubt. And okay, I'll talk about vaccines, and then we'll talk about, a framework in terms of prioritizing mitigation strategies, because there's so many, and that document is very useful. But I think we understand, having worked at the grassroots level with so many organizations, resources are not numerous. They are often limited. So I'll share that piecemeal, I think, towards the end of my piece. But I'll start with vaccines. Yeah, without a doubt, I think vaccines is what has gotten us to where we are today. And let's start with some numbers, actually. So if you look at our current status, globally, the numbers are going down. But you know what? You say globally, you don't really know what it means, because in some part of the country or in a country, the numbers are through the roof. And in a country like United States, there is a significant downward trend as it relates to cases. If you look at California, we are seeing again about a 20% decline in cases, hospitalizations, and deaths. Obviously, deaths lag behind, but it's very encouraging, the downward trend. In addition, I think in the background, the vaccination in our country is around 55, 56%. If you look at different states, it's as high as 85%. And I'm talking about 2 doses. I'm not talking 1 dose. Because if you recall, 1 dose, something like B1351, if you recall, the variant from South Africa, that can easily infect you, that can easily overcome 1 dose, as in 1 dose is no good for it. So we're just going to talk about 2 doses considered as fully vaccinated, as vaccinated. So it varies. It's across the country. A place like Vermont, a place like Massachusetts, Hawaii, they are north of 80%. California and counties in California, we are in around 60, 65%. Now, with that, our cases are going down. Understand, we talk about immunity induced by vaccines. There's another piece that we shouldn't forget. That is immunity that is conferred in our community as a result of natural infection. Keep that in mind. And there is, in fact, not too long ago, the statistics that were shared with us at a country level was that 1 in 3 people has been infected with the virus. So that's 33%. So at a country level, if you think about it, by virtue of natural infection and by virtue of vaccine, we are probably 80 to 85%, but these are all rough estimates. Having said that, vaccines continue to be very important. And what we've learned now that we are in the present is that several people in our population do need boosters. And why do we need boosters? I want to take this chance to just clarify the recommendations around boosters and why they are important. So what we have learned is that with time, with certain vaccines, the immunity wanes. When the immunity wanes, we are talking about immunity against mild infection that does not require hospitalization. If you recall, earlier on with Pfizer, the data was the vaccine effectiveness was 92, 95%. And more recently, this has been looked at across several jurisdictions in the United States. Now the vaccine effectiveness against symptomatic mild disease is around 72 to 76%. So, in the ballpark, just to kind of understand, every 2 months, there is a 6% drop in vaccine effectiveness against mild symptomatic disease. But the good news is, despite the drop in vaccine effectiveness against mild disease, these vaccines still hold through. They still stand at 90, north of 90%, actually 85 to 90 as it relates to hospitalization and death. So that's really encouraging. And that did not change with time. That did not change with Delta variant. Therefore, at 6 months, people who should take the vaccine, take a booster, are people who are more than 65 years of age, people with comorbid conditions, anyone from, I think it's 50 to 64 years of age. And I'll tell you, these comorbid conditions are very inclusive. Those CDC recommendations are spot on, really. They have included people who are former smokers, people with obesity, your BMI between 25 to 30, go ahead and take it. So very inclusive. And the last category that should take it is people who are living in congregate settings, 18 or more in congregate settings. Then they talk about categories who may consider taking a booster. And that's people with occupational hazards, people working in grocery stores, first line responders, physicians, nurses. And then they talk about people from the age of 40 to 50 or 59, that age group with any comorbid condition. So they've made it very, very open that booster doses help. And we've seen from Israel that they saw a downward trend in their antibody levels among people, and they saw an increase in hospitalization. Therefore, boosters are important. The last thing I'll say about vaccines is that, and it's on everybody's mind, is where is the story around vaccines for 22 million people in our country? That's children. Right? Where is that? And it's so important with kids going to school. And as you know, the numbers in that age group, around 22% of the cases that were diagnosed 2 weeks ago were in children. And these are school-going children. So where are we with that? Pfizer has figured out the dose that has to be given. They figured that out in summer. So adults got 30 microgram, kids are going to get 10, 1/3 of the dose. And Pfizer plans to present their data in end of October, I believe it's October 26th, where they're going to talk about getting an EUA. And hopefully before Thanksgiving, school-going children between 5 to 11 would have had access to vaccination, at least the first dose. Moderna is not too far in line. They are also looking at getting vaccines for this age group sooner than later. In addition, now the youngest, when are they going to get the vaccine? Because remember, as our population gets vaccines, that's where we start relaxing and peeling off on so many of these non-pharmaceutical interventions that we've talked about, masking, ventilation, et cetera, et cetera. So the youngest, the hope is that by early next year, they will have access to vaccination too. So that's how the timeline is going to play out. And the reason why I'm kind of sharing this with you is because let's go back to that pyramid. Vaccination on top, followed by other measures that do not rely on behavior. And what are those measures? Outdoors, if you can. If not outdoors, be indoors, but optimize your ventilation. Then there's testing. And we can touch more on that later, what type of testing you're using. So see, these three things, behavior, of course, the first time around when you get the vaccine, that's driven by behavior. But once you got it, you're good for a while. After that, it's ventilation and testing. That is not governed by behavior. And very close to that, the next thing in the tier, in the pyramid, is masking. And when you talk about masking, like I've said always, wear a mask like you mean it. Don't just wear it. You don't want that chin, the diapers. Do a good job about it, because in fact, just recently we learned, was it from Singapore? It was another country, not the United States, that it was, I forget the country, where we saw that there was cross transmission between people. It was between healthcare personnel. I think it was Israel, actually. It was 3.5 times higher, or let me put it in a nicer way, 3.5 times lower if you wear a KN95, opposed to when you just wear a surgical mask, which may not fit very well. So that tells you what's the difference between KN95 and a surgical mask. It fits much better. It's kind of sealing your face. So that's where masking really comes into play. And we could keep going on and on with mitigation measures, but I'm going to stop here, Mel, and give it back to you.
Actually, Mel, can I jump in
Yes,
for a second?
go ahead.
So I think what's important here for our audience in terms of the arts, and particularly as we're getting, it's actually, I think it was 39 degrees this morning here where I live. We're moving indoors now, right? We were outdoors as much as possible, but we're really getting into late fall, winter. So these mitigation factors, some cities like Los Angeles, I think have just mandated that in order to be indoors, you have to have proof of vaccine, or I believe a negative COVID test. It's one or the other. I think that's what happened in Los Angeles just recently. Is that correct, Trudy and Dr. Nanda? Yeah, okay. So, but there's other counties, we've got 58 in California, that are not requiring the same. And as we know, it's gone to locals. So as our theaters are going now into indoor activities, what is the recommendation from you, Dr. Nanda, and then from the state in terms of should you require vaccination? Number one, would that be your best mitigation factor, that everybody in the audience is vaccinated? Or vaccination and negative COVID tests? And then as we're indoors, do you recommend that people keep their masks on for the shows that we're putting on? And then finally, there's a lot of question around intermission, because typically we have intermissions. Let's say at a lot of theater shows, it helps our bottom line. We can sell drinks and food and merch and all of those things. It also gives the performers a rest. Everything, right? Theater is built around this concept. There's a lot of conversation that get rid of intermission, fewer like opportunities for people to hang out. There's all those sort of things. So tell us what you think if you were running a theater. Your perspective as an infectious disease specialist, Center for Emerging Pathogens, what would be the way to operate?
Julie, these are great questions. And I'll start by giving some broad strokes. And then we will get into some minutia, so it's actionable for the audience. Okay, so the broad strokes are that the more mitigation strategies you have, the more you can do. And more you can do at a given time. I'm talking about intermission here. And you can do it for a longer time, because ultimately we want smooth and normal operations without getting interrupted with, an outbreak, et cetera, et cetera. So with that, ideally you want your audience to be vaccinated, ideally, okay? Now, that may be our true north. It may not always be possible. Then you have to get testing into play. Yes, now testing also, there's a turnaround time. Yes, we would like for people to be tested 48 to 72 hours prior. Closer to the show or the performance, the better it is. But if you tell someone 24 hours, it's not always possible. So the more things you tack on, the more things you can do. So imagine an audience. Let's just for a minute, imagine a situation where you have a certain number of people, all of them are vaccinated. all of them are tested in the last 72 hours. And what you have then done is, before they entered, because there's 72 hours, and not that everybody will be quarantining, right? In those 72 hours, they're going on their life, right? So they do an antigen test just before they come in. I'm not saying do everything, but I'm trying to just give you a sense of if you want to create a bubble. And then you peel off, because ultimately we can say what we want, but it's resources and what is logistically and operationally possible. So imagine that audience where everybody's tested 2 times. I'm not saying do that, but I'm just putting it out there. And then they get an antigen
You are saying
test.
do that. You're saying ideally that would be your recommendation. We know operationally that's not necessarily possible for organizations that are run by volunteers at the front lines, that sort of thing. And what would the audiences do? Would they even show up if those kinds of requirements? But you're saying from your perspective, as someone who's studying this.
So yeah, Julie. So with that, then maybe I'll say that you don't need to mask. That's where I was going, right? Because you tested them so many times. But okay, that is logistically a nightmare, what I just painted for you. Okay, so I know we can't do that. Therefore, let's do the masking. Let's do ventilation where you're not relying on each person sitting in the audience and wearing the mask the right way. And what I just want to share is, in ventilation, what's actionable is you want cross ventilation if possible. You want HEPA filters if possible. You want to make sure your air exchanges per hour are at least minimum. There's a nice CDC table. If you go to CDC, air exchanges per hour, and that's the time it takes to decontaminate the air in the room. Utilize that and optimize your HVAC system accordingly. And then there's another thing, there's this carbon dioxide monitor that has gotten popular. It started in the UK, where you can take measurements, but that doesn't tell you the entire story. It's simply a marker at that time, that when it's above, 550, more than 700, that's not great. Julie, I'm going to stop there, and I'd love to hear what Trudy has to say. Please, Trudy.
Interesting, thank you. You mentioned all of the things when we talk about kind of what our present toolbox is. And I think it's important to talk a little bit about where CDPH is and what our toolbox looks like post June 15th. June 15th was really that pivotal date and really established this baseline as we moved into this idea of really just reopening the economy. Business was allowed to function the way they normally did. We, as a state, got out of, for the most part, outside of, mega events, we really got out of the business of trying to tell business how to run their business. But with that being said, the one thing I want to highlight is, I talked about this huge toolbox that we had pre-June 15th. Dr. Nanda, everything you just said is really all that's left in our toolbox. It's masking. We like to call it the MTV plus. It's MTVV. It's masking, testing, vaccine, and ventilation. And that's really kind of what's left in our toolbox. And we talk about it as this Swiss cheese approach, where you've got all of these layers. And so theoretically, you've got kind of this, even though it's got holes in, each one individually may have a hole in it. When you put all of those things together, you've got this really great barrier for protecting the participants, protecting the audience, protecting, and so that's why we're really still focused on those 4 particular kind of slices of cheese and those 4 mitigation measures, because we know, masking is still going to be really important, especially I think in indoor settings. Testing, incredibly enough, I think many thought as we were starting to move out of some of the surges and into this idea of reopening the economy, we saw huge drops in our testing numbers. We still think it's a very, very critical piece of those mitigation strategies. It's one of the best ways of just knowing immediately right there, kind of what your status is, so that you can make an informed decision. It's still really important, and I cannot stress enough how important testing continues to be. And obviously vaccine, We are in the process now of really doubling down on our vaccine efforts. One of the biggest things that I want to highlight is, we're doing a lot of work at the state level, really just trying to counter a lot of the misinformation and disinformation that unfortunately has just been, I think has really just stymied so much effort, stymied so much of the hard work that our community has undertaken, stymied the blood, sweat, and tears, quite frankly, that everybody has put forth, over the last 18, 20 months as part of this effort. So we're really doubling down on the idea of how do we start to address a lot of the mis and disinformation. But even on the vaccine side, and I think Julie would love to hear your thoughts on it, we're partnering now, with folks like Julie and her team on how to do pop-up vaccine clinics. I think we first entered into this with the idea of, if we just stand here, they will come. But we know that we need to go out to certain communities. We need to be able to reach folks where they are. And so partnering with entities like Julie and her organization. And that's one of the great things about this pandemic. I think Dr. Nanda, as you had alluded to, is the relationships. Which are not natural relationships, let's face it. I mean, CDPH having a natural relationship with, California, the arts, it's not a natural relationship.
Or the arts knowing about ventilation, not
exactly.
Not so much either. That's not our focus. But yeah, I mean, we are doing pop-up vaccine clinic, sort of trying to get venues, as you were saying, Trudy, we're working with your team. So if you're a venue watching this, listening to this, and we can put my email in there, and you're interested, particularly in there's certain counties that we're really focused on, which I can also share. I don't know if I have that handy. I don't know if you do too, Trudy, the ones that we're really focused on for the pop-ups, but basically it's where there's lower vaccine, numbers. And it is to actually use your venue potentially during the day when you're actually not doing the shows, but doing the pop-ups during the day too, because we know arts organizations are trusted community partners, and also if you're going to require vaccines in order for people to come to the show, then why not make it easy for them in offering an opportunity for them to come and get that vaccine? So if you're interested in participating in that, and then if you're doing much larger events, we've done some pop-up vaccine clinics with big festivals and things like that. Obviously, that doesn't work if they're requiring vaccines at the festival, but if they're requiring a negative COVID test, but we want to maybe get people incentivized to get vaccines, that's kind of what we've always tried to do, is using the carrot of the arts. But I think one of the things in looking at some of the questions too that people have is that actually getting rapid tests or getting tests is really difficult right now, in bulk. Do you know, Trudy, from your perspective, from the state's perspective, what are the sort of measures that you're looking at to try and make that easier for people?
Yeah, I mean, we are working really hard. I know at one point it was the ability to get in specifically Binex tests, which we make available if you partner with the state on the rapid antigen program. We were starting to see a little bit of a stall, and it was definitely concerning for all of us in terms of the supply chain. I think we saw this early in the pandemic, huge supply chain issues around testing. And so we're starting to see a little bit of that now, but I think what we're also doing then is really starting to look at other avenues, Care Start. We're building a really great relationship and being able to use Care Start, and, for entities that want to partner with the state, and I'll put that information in the chat. We would love to continue to be able to partner with industry on how we provide testing to employers and those kinds of things, because again, it is such a critical piece of it. I think one of the other areas, and I was going to save this for a kind of discussion, but since you asked, we're also really taking a hard look on over-the-counter tests. They're really starting to, I don't want to quite say flood the market, but they're definitely out there. And they are being used more and more in certain settings. I think it helps to address certainly accessibility issues for many, because we've heard really across the state in certain areas, equity issues around just being able to get testing resources or having people come in to get testing. And when you think about the northern part of our state, where it's very diverse and, they're very small and they're not well resourced, sometimes testing turnaround times can be really lengthy in some of these areas. So we're really starting to take a hard look at over-the-counter tests and seeing that as a way to possibly address a lot of the equity and accessibility issues around testing. And I think, folks are really looking at it also as a way just for being more informed. That's the other piece of it. We think it's a great resource to just be more informed so that you can make informed choices about, do I want to go out to this event? Should I be wandering out into the community? Should I be going to see, my extended family? I think it's a great resource for, again, being individually more informed so that you can make individual choices.
Yeah,
if I can add, sorry, Julie.
I was just going to, and I want you to jump in on it too, but I just was going to say, I think for our sector, what's challenging there is that we're talking about a lot of tests potentially for people at the door, that sort of thing. And, I think I just took one myself, because I was in some area that I thought might have been exposed, and it's $30 for 2. Yeah. So they're expensive. So in terms of equity and accessibility, that's the only thing I'm concerned about, but I know we're going to get to a good solution on it. So we'll figure it out. But Dr. Nanda?
I was just going to add to what you and Trudy said, that I'm sure if the audience doesn't know, that there is a national effort by the Biden administration to deploy, and they've already actually put in several resources into rapid tests. So one of the common tests that Trudy alluded to is the Abbott Binex, and the other one is, I believe it's ACON. It uses the same technology. So that means you'll have a result then and there within 15 minutes. But hopefully now the markets should be in the next few weeks be flooded with tests. And yeah, it's exactly, I think, $27 or $30, and you have 2 swabs in it. So it's relatively expensive. And the reality is that if we had a lot of these, similar to what they've done in EU, similar to, actually, it was even published in one of our scientific journals, this huge concert in Spain, where they had everybody tested before the concert. And at that time, I don't think they had mandated vaccination. They had some cases there, but at least it wasn't a huge outbreak. So the point being, now you have vaccines, you have so many other things, and easy accessibility to test and optimizing ventilation. It was an outdoor concert. We can leverage it and keep our industry running.
Yeah, and we are really hoping, and I agree, Dr. Nanda, there's a huge federal effort right now to make over-the-counter testing much more accessible too. I know they're working with, I think it's food banks and other community settings to make over-the-counter testing possible. So, I think we're definitely going to keep, an eye out for what happens at the federal level, because I think that really is kind of where the future is going for some of this testing.
Yeah.
Sounds like a perfect time to ask the question of the century. Will we ever get back to normal? And when will that be? Dr. Nanda, please give us hope.
Okay. Okay. What does the future look like? So first, let's define our true north. Our true north is where there'll be normal operations. And this virus, by the way, I have a little bit of a struggle with the word post-pandemic, and perhaps Julie mentioned that, because this virus, it's going to keep circulating, and it is how we handle our environment that we consider living with the pandemic, and we don't interrupt our smooth operations. So with that, we are just on the downslope now with the Delta variant. To answer Mel's question, will we ever get back to normal? Yeah, of course we will. But your new normal, or our new normal, is going to be with SARS-CoV-2. That is our new normal. What's going to happen is with time, perhaps we will not be talking so much about testing. We may continue to talk about showing our vaccine cards. We may continue to talk about, if you're not well, don't go out. I don't know how far that's going to go. But, a vaccine card is like a driver's license. That is something I think that will continue for a while. Because remember, not too long ago, we thought that it's all over. But I'll tell you, infectious disease physicians did not, because we knew there's Delta variant in Asia. And what's very obvious to all of us is how interconnected we are globally. In a matter of 2 months, what was happening in India, we saw the same thing here. And now that we are coming out of it, yes, I know we want to come out of it, but at the same time, the normal is going to be slightly different. When that normal will be, it's anybody's guess, but I will try and guess. And I think that in our country, likely say spring, late spring, when vaccines will become available to everyone, and perhaps we will be past a little bit of winter bump that we may see, because again, there's going to be congregation. Already we are seeing, some cooler states, the numbers are going up slightly, but it's not going to be anything like what we saw last year. So I think perhaps around then we will start seeing the virus will be there, but perhaps we will not have to keep interrupting our operations as much. But know that it's going to be a long time before we say we are not going to be talking about COVID-19, because there are so many countries where access to vaccine is still a problem. Even in our own country where we don't have a problem with vaccine, right? Today, 56% of our population is vaccinated. So we have 44% of the people who are not vaccinated. By that, I mean 2 doses. And that's a perfect setup for a new variant, right? So all this obviously goes out of the window, the timeline that I painted just now, if there's another variant, not perhaps a super Delta, and I hope that doesn't happen, but things change. But I think it's clearly a race between vaccination and a variant, without a doubt.
And it's living with the pandemic, as you say, versus it's saying that we're going to be over. So the question for our sector is, how do we have a variety of people that we're working with. Many have volunteers. We have performers. Some are union with very specific requirements, some are not. And then there's also, of course, obviously everyone wants to keep everyone safe in all of these circumstances. We have audiences, we have staff members, and then we have vendors. So the other thing that's happened in this, with all of this, is that we also have to hire more security, for example, to make sure that people are wearing their masks, that they have their vaccine cards, that they're showing their negative COVID tests, et cetera, and so on. And so, excuse me, we have a variety of audiences that we're dealing with. And one of the calls I was on recently that was interesting was that we also have a labor shortage in all of this. So it's like, it's sort of a still, we are definitely not back to any sense of normal, both, in terms of the pandemic, but in terms of our sector, really, it's really not, we're not there yet because of all these concerns. There's been a couple of questions in there. And one of them was around social distancing, not something that we've heard about now since June 15th. We were appreciative of it, certainly when before the Delta variant, because we said, great, we can all kind of start to gather again. What's your feeling, Trudy, first, and then maybe to Dr. Nanda, in terms of social distancing? I'm talking indoors, based on what we know today. And I know that's not a requirement of the state, but what's your feeling in terms of where we are with that? Because some audience studies are saying that some audiences feel that that would actually be safer than sitting right next to someone in a theater for an hour and a half.
Yeah, I think and I agree with all of you. I think our future is living with COVID. We'll never get to zero transmission. I think that's just unrealistic. We're not going to get there. It's going to be just part of kind of this normal scheme of other diseases, I think, that we normally live with. And so it's going to be, our normal is going to be living with COVID. But to your specific question, Julie, around physical distancing, there's a reason why we kind of really took that out of the toolbox, because I think with what we've got, those 4 measures, really, number one, masking is one of the simplest ways to help, really mitigate spread. And we're really also, just so you know, thinking more about this idea behind masking, and Dr. Nanda had alluded to it, putting out more information about what's good, better, and best, even in terms of masking. Is it 2 layers of a cloth mask versus 3? Is it double masking? So is it a surgical with your cloth mask? Because of what we're starting to learn about the disease. I think early on, we were seeing it as these heavy kind of particles, but it's really much more airborne. And so we're really starting to think about how we design messaging so that folks are better informed about the choice of mask, seeing, how this disease has evolved, and seeing how we're really moving from this idea of heavy particles to it being airborne. So that, I think, is, one area that we're really looking at for the future. Just because, again, we see it as a really simple way in order to protect yourself and for those folks around you. I think, being able to just double down on our vaccine efforts really is also incredibly important. Ventilation as a long-term strategy, because if you think about it, and it kind of goes along with the masking and the ventilation, think about the respiratory diseases we normally deal with during every winter. We're starting to look at modeling now between flu and COVID. But if you think about all of the other respiratory issues we deal with on a regular winter, masking could really help in that arena. Ventilation is a great long-term solution in some of those areas as well, beyond just COVID, but really addressing some of the other respiratory infections that we deal with on a regular basis that I think we've kind of forgotten about. So it's being able to double down on some of these things, and then, making sure that testing is accessible. Really, I think we can get to where we need to be without impacting the economy. Because I think the one thing we realized is social distancing naturally ends up creating capacity limits. And that's and we don't want to get back to that point. We want to be able for the economy to continue to function with strategies we think are just as effective, but don't put us back in that really difficult position where we, as much as we're trying to balance now, really was an imbalance, as we were really trying to protect public health. Unfortunately, economically, our sector suffered. And so focusing, I think, on the 4 that we're looking at gets us to the same place without affecting the economy, hopefully.
I think that's
and that's the balance we want to strike.
Yeah. And I think that's good news to people, listening in who are in the sector here, and who also in terms of what is your response to people, because there's a lot of comments around, there's frustration of some audiences saying, I won't go unless everyone's vaccinated. And then other audience members saying, I don't want to get the vaccine. Yeah. And so, if everyone follows your MTV plus VV, MTVV, you're saying that we should be able to live with the pandemic if we're masked, if we're negative COVID test, if we're getting our vaccines, the combinations and the ventilation. And so I think for those of you who are, facing that frustration, I think it's really important to also educate people that we don't want to have to get back to limited capacity, because it's not feasible for us to survive. And so your theaters that these folks want to go to won't be here if we have to socially distance inside because people won't wear the mask, for example.
Yeah. I mean, if I could, if you think about it, I know this is a different setting, but we're having the same conversation around schools.
I was about to say that, Trudy. Go ahead, please.
Such a push in terms of bringing kids back and full in-person instruction, because we know that's so important. You cannot replace in-person instruction for children. You just can't. But what we're realizing, it's those same simple mitigation measures. As you see, we've taken away physical distancing in the schools, but still applying those simple mitigation measures around the masking, where we can really start to focus on ventilation, really, focusing on making sure that kids are vaccinated when they become eligible, or those that they're around are either vaccinated or tested. It's continuing those same simple mitigation strategies that's allowing us to, to do in-person instruction. And what we're seeing on the studies and in the numbers is it is a safe place. Schools are absolutely a safe place for kids, just using those simple mitigation measures.
Trudy, I like where you were going with it and where we've landed. And I'll share with you how I've thought about how the story around transmission dynamics changed and where we have landed today, where we say, it's not pragmatic to keep that physical distance, whether it's school or in theaters. So the science still tells us, like you mentioned, it is something that is aerosolized. And for the audience, aerosolized is what Trudy is saying, that they are small particles, they travel longer distances. And then the other end is droplet, that is, they are big, so they fall within 3 feet. The truth is, for this disease or other respiratory disease, there is a spectrum. It's not like one disease is airborne, one disease is droplet, one disease, it's, more than 50% of the particles travel farther. Having said that, we recognize, I think, and that's what Trudy is saying, we recognize that it can be aerosolized, it can travel farther. But despite that, when you add other things like vaccination, testing, and ventilation, we are willing to let go of physical distancing. And that was what we saw in that study that came out in Massachusetts, where they looked at different school districts and they talked about, you don't need 6 feet, 3 feet distance is enough. But guess what? If you look at that study very closely, they had excellent mitigation strategies in that school, yes. Right? And think about it, even like when we are talking to individuals in clinic or hospital, it's very difficult to keep that 6 feet distance. It is not possible. How do you expect a child to do that? So I think it's like living with the pandemic. We have learned that physical distancing is not something that sits well with human interaction. And therefore, we are putting so much of an emphasis on ventilation and testing and masking. I'm kind of just sharing how I kind of settled with the science, even though I know it, it travels very far. But look, we are doing other stuff, and that's how we justify living with the pandemic and keeping normal operations.
If anyone has any closing remarks, this would be a great time. Otherwise, we can get into some questions from the audience.
Mel, I just finished talking. So anyway, but I just have one remark that, this is not the last time that we will see an upheaval as a result of an infectious disease. We are so interconnected globally that this is likely going to happen again. And as we are learning to live with COVID-19, I think at a grassroots level, it would be good for organizations to also think about this framework. Should there be another upheaval, right? Already, there's Ebola, there's MERS, there are other things that are circulating. It may not reach to this level for the next 3 or 4 years, another disease. But with the diagnostics, with so much of traveling, it's very likely that it'll happen again. So, whatever you have invested your time and effort in, use it as a framework, because you may need to use it next time around, and you don't want to interrupt your operations, because that's our economy at the end of it. Yeah. Please, Julie, Trudy, if you have anything to.
No, I thank you for ending with that. I will be the first one to say it is not about if, it is about when. And so we need to take these last 20 months of blood, sweat, and tears and really learn from it. And we have. We've learned a lot. You've seen us pivot in certain areas because we've taken the time to really look at the science and really be able to understand also, where our strategies. I think that the physical distancing is one of the perfect examples where we're starting to realize, these are the simpler mitigation strategies that still get us to the same place. but don't necessarily have to have such a huge impact.
Yeah, and so hopefully, people are not, I think this is really important for us to recognize, all of us to recognize. That's why we called it Living with the Pandemic. And we also wanted to talk about just, these are the things that we need to understand how to operate and operationalize as we go forward, particularly in our industry with so many variables and how we work. And I just want to add that we have on November 17th would be our next one, and that'll be very focused on youth. So I saw some youth questions, which we can address tonight, but I also want to let you know that we will be talking about specifics on how to work within the youth community and do youth programs, whether that's in school or out of school, that you're offering. And we will address that on the 17th. And on the 15th, we'll really do this sharing that you see in the questions. I see a lot of those about how do you handle this within your theater, and we'll have an opportunity to do more of that on the 15th as well. So I just want to give you guys a heads up on that and ask that, just sign up again. It's all free. But I did want to get a chance to ask some of the questions that are in the Q&A, because we've got 14 of those. So I'm actually going to start with the one that goes with going by the MTVV suggestion. What about singers? Because we've heard a lot about this in the past. And so where are we today? If we're all vaccinated, all the singers are vaccinated in an appropriately ventilated space and all masked, although I don't know if you are going to sing with a mask on, do we need to distance? Trudy or Dr. Nanda, your answer.
Yeah, I mean, if they are all vaccinated, if they're all masked, no. I mean, and I do want to take a step back. We've always acknowledged things that kind of expel, air and particles, more singing, shouting, the wind instruments, those kinds of things. Absolutely, those are certain activities that are riskier. But if you've got that perfect combination in terms of performers where they are vaccinated, but they're also masked, I don't see any reason why they would need to physically distance. I think they've got all of the best measures in place.
So the person just added they'll be not be masked at performances, but only at the rehearsals. So, I mean, because I think it would be difficult to sing with a mask on in a performance. So if they're unmasked at the performance, but they're vaccinated, ventilation's good in the venue, outdoors or indoors, and they've got also negative tests. I guess they're all vaccinated. Here's another question actually I want to ask you guys: that if everyone's vaccinated, would you still recommend a negative COVID test?
It depends on your resources. It depends on how many layers you want. So we know that with vaccination, you can still get breakthrough infections. You can, right? We've talked about how it goes down, 2 points. It was 92% the vaccine effectiveness down to 72%. So you can have a breakthrough infection. And in an ideal world, vaccinated and tested, but that's not feasible most of the time. So go with vaccination, but see, how can you replace that testing? What you could do is, let's not forget the symptom screening that we are still doing in some venues. Rely on that. And perhaps, I don't want to say it's a substitute for testing, but at least it's something. Nobody's coming in with a bad runny nose, because that person has a bad runny nose. That person should be screened out. In that question, Julie, that you asked, that person had also said ventilation. So you have ventilation, masked and vaccinated. And if you have symptom screening, you're okay. But also keep in mind, I think one thing that we should take this opportunity to talk about with this question is a lot of these strategies, or how many strategies you're going to deploy in your area, are governed by the community prevalence. So when the community prevalence is high, and you may know that there's so many tiers, right? CDC has high, substantial, then it goes down. Unfortunately, we are in substantial. We are very lucky. We are the few states. In fact, I think just a select few states are substantial. So you can start peeling off strategies as we move down in community transmission, because then it comes down to probability, right? What's the probability out of, say, 50 people that are here are positive. So something to keep in mind as you tack on more or you peel off strategies.
Great. I mean, there's a question here about vaccinating age 5+ age group, because you talked about this coming, Dr. Nanda. So the question is, how long do you think it will take to vaccinate most of that age group, 5+? And would we realistically be able to safely offer in-person activities for that age group without masks by January? This is getting very specific, so it might be difficult for you to answer that level of specificity.
I think I can take it. I can take it, Julie. I can take it. Okay, so when will we get vaccination for this age group? Yes, I also want it. My daughter is 9 years old. I think it's going to be, so they're going to meet October 26th. Pfizer is going to present their data. Then ACIP, that is an advisory, that's an advisory committee of immunizations, immunization and practices that will make final recommendations. And both these bodies on October 26th, 6th and November 2nd are going to make recommendations to CDC. Then CDC will finally give its blessings that you can use this vaccination, in this age group. So you're looking at probably mid-November that if all goes well, we will have a vaccine available for this age group. So that answers your first question. Also, Moderna is going to do the same, by the way. And now, in fact, across the world, in fact, I read this morning that in Southeast Asia, there are a couple of companies that are looking at manufacturing vaccines for less than 5-year-olds. So it's a worldwide effort. The second question, where the answer I'm not a fan of, but it is the truth, is will we be able to vaccinate the millions of children who are in that age group? I think that depends on how much can we combat misinformation, really. Because, there's this piece around myocarditis, pericarditis. Yes, but you know what? The risk is so much lower compared to when you get COVID-19. So I think that's the piece that has to be shared and socialized. As you know, in California, they have already said that once these vaccines are FDA approved for this age group, it'll be required in schools. So is that right, Trudy? Please correct me if I'm wrong.
It is. And, I will be the first one to applaud our administration for making such a bold move. But yes, as soon as we get FDA approval, it'll either be January 1st or July 1st, kind of whichever, happens sooner. And then we'll be looking at it in grade spans. Because as you know, all of the mandatory vaccines, they're not by age, they're actually by grade span. So I'm excited at the effort. I think it is a bold move, and it is an absolutely the step in the right direction in terms of protecting our children.
Definitely. So that was the second part, Julie. There was a third part, I think.
That was it. No, I think that was it. They basically want to know if by January they can have indoor. So it's hard to answer specifically, but I think you did a great job at answering that. One of the things I think we've heard both of you say pretty consistently is how do we counter misinformation and to make sure that people are informed and with the right tools. What can the arts do in your mind, particularly, you see a lot of frustration from people who are trying to put on shows, do that sort of stuff, trying to do everything right. And then people are not, wanting to comply, let's say, or they're in the middle of the show and they look over and then people have started to take their masks off and do all that sort of stuff. So from your perspectives, and this isn't necessarily scientific, or maybe it is, maybe there's things that are there tools, are there signage, are there things that you recommend that people should be putting on their, walls that talk about how to address the misinformation so that they're not in battles with people, literally. And as someone said, they're 80-year-old ushers having to, talk someone in that way. But what are some of the tools that you can help us or places that people can access this information to really be able to address some of the concerns that people bring?
Well, I can certainly say at the state level, we've got that, and you've worked with them. Our Vaccinate All 58 campaign, I think, has done some amazing work, and I'll make sure to, through Julie, get you some information, but they've created a lot of collateral materials, a lot of social media materials, because we know so much information is consumed, but also so much misinformation is absolutely consumed via social media. And that is the very unfortunate part. It is a mechanism we're using to get out right information, but unfortunately it was also the mechanism to spread so much of the mis and disinformation that we're struggling with right now. But they've done a great job creating collaterals, creating a lot of things around social media. They even have, and I'll share it with you again, Julie, later. They even have an email box called Rumors. I think it's like rumors.vaccine.ca.gov, where folks can input rumors that they've heard so that they can actually, get pointed to the right information. But we also want to hear about what are the rumors that are being spread, because they're just so varied, and it helps us create messaging, targeted messaging about very specific rumors that you may be hearing. So I'll make sure to share all of those things, but that's definitely one area that I would really encourage folks to look at.
Trudy, if I may add, one of the big things, so I'll tell you at our grassroots level through the center, we have done webinars and Q&As for some nonprofits, and one around vaccine misinformation. And one thing that comes up again is reproductive hazard with the mRNA vaccine. Rest assured, there isn't an impact on the reproductive capacity, because people who are looking to conceive, there was, in fact, even my peers, they were hesitant in February and March earlier on, but now it's been proven that it's very safe.
Yeah. And even to that end, recently, the feds have come out with that urgent messaging about pregnancy and COVID vaccine, and that it's recommended and it's important. And so we're really trying to stay, on top of the science and those things coming out at the federal level, and really helping to pivot a lot of our messaging focused on that as well.
There's also, I think I've read some studies where there's audience hesitation also around contact tracing. Is there anything you can just share with us in terms of, to alleviate some of the concerns there, and why A, it's important, and B, why, they shouldn't be concerned in terms of maybe it's privacy or whatever it may be?
Yeah, no, contact tracing, it is something that we have done at the local levels, for all infectious diseases. So please don't think it's just specific to COVID. Local health departments and local health jurisdictions have been expert at contact tracing and case investigation for as long as, we've had local health departments. And they are trained to really protect your identity. They're not trying to capture this information in order to use it. What they're trying to do is really be able to help identify, and being able to use the individuals and be able to identify who those potentially exposed individuals are. But you should not be concerned about, the data may go somewhere. Local health departments may share the data. They're very expert. It is their role and responsibility to maintain the integrity of all of that activity. And again, be rest assured, this is something that local health departments have been expert in for as long as, I've been in public health. It's a tenet, it is absolutely one of those core functions of local health departments. They do it for every sort of communicable disease, certainly not just COVID. So know that there is a ton of history, a ton of expertise and experience behind it.
That's terrific. And so, one of the things I just want to, I think we're almost at the end here. I want to thank you both for your expertise and your knowledge, and for sharing. I also just want to remind people that this, and Trudy, you can just quickly, if you would speak to this, is that really the state is sort of relinquished the guideline business in terms of determining how industries should operate. And it's really gone to the local public health to make the determinations, except for, you have some guidance and recommendations, but really not anything required more than what, is CDC or whatever it may be. And except for mega events, which now we are gone down to 1,000 for indoors, correct?
Yes.
Okay.
Yeah. And so it really is that kind of June 15th baseline that we were talking about, like, beyond pre or within the blueprint and then beyond the blueprint. I think what folks may not be aware of is prior to this pandemic, the relationship between the state and the local health jurisdictions, the state typically set just kind of broad guardrails around things. And then it was really at the local level that implemented those, what recommendations we had, but with very broad guardrails. Only with this pandemic in the decades that I've been in public health have I seen the state come in and really put in rules, be incredibly prescriptive, really set up, certain requirements, especially with industry and things like that. And I've been in public health almost my entire professional career, with the exception of like 8 years kind of mixed in there. And this is the first time I've seen, the state really come down and act as in that capacity. Normally, all of those things really are done at the local level. And I think what folks now are maybe uncomfortable with is this idea of the pendulum starting to swing back a little bit, where the state isn't taking such an active, prescriptive kind of telling industry what to do role anymore, and really now looking at the local level to be able to implement some broad recommendations we've got. Julie, as you said, we still have the mega events guidance that's out there because that was really focused on, where we can continue to have some high yield, high value impact in terms of continuing to mitigate spread. I think we also were mindful that there's, certain criteria, and maybe this is for a bigger conversation around mega events that we continue to see, as continuing to be high risk in those nature, but it's very limited. It's almost like I talked about, our toolbox is much smaller. Our toolkit is much smaller. And with that toolkit being much smaller, you're going to see that pendulum really start to swing back at the local level. And that's where it normally is. Outside of a pandemic, it's really at the local level that we rely on to look at operationalize something, implementing some broad recommendations that come from the state. And so I encourage everybody, I know it can be difficult because we have 61 jurisdictions. And so unfortunately you have 61 jurisdictions. And sometimes it's going to be different as you move from county to county or even from city, because we do have 3 cities that have their own local health departments. I know it's difficult, but this is really just a little bit of that pendulum shift back to the local level. And so I just encourage everybody to be really knowledgeable about where to find that information on their local public health site, because usually it's all there, but I really encourage everybody to be really knowledgeable. And when you need to, absolutely reach out to your local health officer and your local health department director. They're really also an incredible resource to talk to you about what they've got in place at the local level, what they're seeing, in terms of community transmission at the local level. They truly are the experts in terms of what they're seeing at the local level and why they're putting certain things into place or otherwise.
I think that's really important. I just want to encourage people to develop those relationships and to reach out locally. I think, the state is as Trudy said, so that's really important information for everyone. Dr. Nanda, did you want to close us out or?
Yeah, sure. I think this was really insightful. I learned so much as we were talking, and especially listening to Trudy and Julie, how you guys have collaborated and how you have at a state level, Trudy, pivoted, from holding people's hand, which we had to because it was the pandemic. And now, everybody needs to have the knowledge to move on I think it's true to our title, Julie, living with the pandemic. So I hope everybody enjoyed it. It was truly a pleasure talking with you guys, and hopefully you'll join us for our next series, our next webinar, November, right?
November 17th, and that'll be a focus on youth programs. And then December 15th, where we'll have really more of an opportunity to share strategies that people have been doing. So I hope also that this was useful. I really appreciate everyone showing up at evening hours. I can hear my husband cooking dinner. So it's time for all of us to get some food, and stay safe, stay well. Thank you so much, Mel, for all your work and for putting this questions together and everything else, and to our team, Eddie and Tracy and everybody else. So we'll see you next time. And stay safe. Thanks again. Bye.
Thank you, Julie.
Bye.
Bye.
Hey, Eddie.
Hi.
Hi. So I think you're probably going to get all the prompts because you're still the host to,
I think we should end it because it's recording.
yeah. Or you could pause, you could stop the recording. Just that white square. Oh, I can stop it here.